fire cupping is an Asian technique. And now we have a new way of doing that. And we can still achieve the same therapeutic effect, which is by using a piston that will dry the air out from the cup and then put on the spot where the patients had a problem. And then we can still achieve the same therapeutic effect as the glass cupping. What we're going to do is that we're going to put on the area where the problem is. Put these pistons on top of the cup and then draw the air out. Usually it's about 2 to 3 times, depending upon how much suction. Each time when you pull up this handle, you can see that the skin is pulling all the way up. And then slightly twist it and then we move. Before you let go, make sure that the cup is intact. If you hear some hissing sound, that means there's some air going in. Either the cup is not in well contact with the skin, or the cup itself is broke, so that there's some area that allow the air to go in. Okay. In this case, we're going to go like a 3 times, 3 cups on each side, along the meridian, which is the urinary bladder meridian. Again, the number of cups that you are using depends on the condition that you are treating. There's no any fixed rules that you have to use certain number of cups. All these cups are usually applied on the muscular areas, not the bony area. And there's a different size of the cups that is depending on the contour of the muscle. The small cup will be used on the small area where there's an irregular surface. The big cup will be used or applied on the big area where there's a flat surface. The idea is to not letting the air to go in when you apply, in case there's any bleeding or there's any infection. First, I have to say that if you follow these rules, you should not see any of this condition. But it does happen on you, then please refer the patient back to their medical doctor if it is out of your practice. In European countries, this kind of cupping therapy has been widely used for 100 years or so. History tells us that in the old time when Marco Polo went to China, he carried this kind of technique back to Italy. So in Italy, there's a lot of people, or in European countries, there's a lot of people using it. Some people call that as a bunkers, particularly in the Jewish community, and some people simply just call it as a cupping. They use that a lot for people who suffer from pneumonia, muscle pain, asthma, or some kind of fever. But in the Chinese traditional medicine, we normally use this for the pain or for people who are having the fever. Then we sometimes use that. But again, some anecdotal evidence tell us that they will use the other conditions. But there's no any scientific proof on this kind of areas as far as for the therapeutic concern. After about 3 to 5 minutes time's gone, you're going to pick up this cap up and then up. Once you pick up this one, the air will go in, And you can see that you can easily remove the cups one at a time. And you leave a very even circular mark on there. Again, this kind of bruising mark or the redness can last anywhere from 3 to 5 days. Please give a patient some warning that this will persist. Phenomenal. And I hope by watching this video, it will give you some general, simplified way to have better understanding what the cup. And in case you or your loved one or your friends suffer from some muscle problem, and then if you ask your acupuncturist or the physical therapist if they understand this technique, and they'll teach you, and hopefully you can email me if you have any questions, and we love to hear from you. And thanks for watching.